A mother and her new baby. How sweet is that? So you think a mother would be happy, wouldn't you? Well, let's take a look to see how sweet these things are in this true story. On the ppdsupportpage.com, a 2009 article tells one of the woman's experience. On July 2nd, 2000, a mother gave birth to a beautiful little girl, which was her first child. It was a much anticipated arrival, and she was so excited to have the little girl in her arms at last. But when the baby girl turned about 4 months old, the mother was having horrible, intrusive thoughts about harming or killing herself, meaning paranoid thoughts and severe anxiety. She was having horrible nightmares, and she couldn't eat or sleep. She didn't want to take care of her baby, and she was so afraid that something was going to happen to her baby. The mother didn't understand what was going on. In this story, the birth of a new baby jumbled a bunch of powerful emotions, from excitement and joy to fear and anxiety. But it also can result in something you might not expect. Depression. This type of depression is called postpartum depression, or PPD. Let's explore this mother's world and find out what exactly postpartum depression, some probable causes, the symptoms, and the treatment for postpartum depression. First, we will find out how postpartum depression is defined and what causes it. Many new moms experience the baby blues, which is a mild, short-lived depression. According to the American College of OB and Gynecologists in May 17, 2010 article, about 10% of new moms experience postpartum depression, a more severe form of depression that can develop within the first 6 months after giving birth. For women who have this, their feelings can be so strong that they can't interfere with daily tasks. Experiencing depression after childbirth isn't a character flaw or weakness, it just may be part of giving birth. What exactly causes this depression? Well, current research still has not determined what causes PPD. From the article ACOG of May 17, 2010, it states what is known is that pregnancy and postpartum period following the delivery are times of great biochemical changes, complicated by increasing social and psychological changes. These can create an environment for postpartum depression. The following risk factors have been identified for postpartum depression: marital problems, depression and anxiety during pregnancy, lack of social support, traumatic birth experience, or stress and negative life environments occurring during pregnancy, such as death or moving. Next, we are going to explore some of the symptoms of postpartum depression. Postpartum depression victims may suffer from a few to several of these, including mood changes, sadness, anxiety, hopelessness, anger, excessive crying, sleep problems, weight gain or weight loss, disinterest or excessive concern over the baby, fear of harming the baby or oneself, guilt, worthlessness, and etc. Finally, we now know what we are dealing with. So let's find out about treatments for this serious type of depression. According to a WebMD article published in January 2009, a list of therapies for postpartum depression includes antidepressants, psychotherapy, and supportive treatment. Selective serotonin reuptake inhibitors, or SSRIs, which work to restore a chemical balance in the brain, are usually the preferred treatment for treating postpartum depression. Certain SSRIs, with Zoloft being the first choice, are commonly prescribed for breastfeeding babies for women because they pose no risk to their baby. SSRIs take about a month to take full effect and improve symptoms. These are several types of psychotherapy that have shown to be effective for depression, including congenital behavior therapy, which aims to solve problems by thinking how you feel and what you do, and there also is interpersonal therapy. Research has shown that mild to moderate depression can also be treated successfully with each of these therapies used alone. Supportive treatment is another choice of treating postpartum depression. The best way to help with all the mixed emotion and feeling that PPD brings about is to talk to loved ones and friends. There are different kinds of supportive treatment, which includes rest, emotional support, avoiding isolation and going out regularly, time alone with a partner, and support groups. As you can tell, postpartum depression is a very serious illness. When we went through this mother's world, we discovered that postpartum depression is not just the baby blues. We found out how the cause depression in mothers and what some of the symptoms are. We learned how to treat this condition. So whatever happened to the mother and the little baby girl in the story? Well, at first the mother wouldn't tell anybody about her feelings of anxiety, thoughts about harming her baby or herself. Her symptoms got worse and worse by each day that went by, and finally the mother realized that something wasn't right, so she had to go talk to someone. The mother got help by consulting with doctors, psychiatrists, and by venting her feelings to her family and friends. Her journey wasn't easy through postpartum depression, and this is what she had to say about it. The mother from the PPDSupportPage.com article stated, "Dealing with postpartum depression is like a roller coaster ride with many ups and downs. I found out the best therapy for me was to tell people what I went through and how I was feeling. The road is long, but I know I can make it to the end." And with this said, she got through it, and now she's living happily ever after with the little baby girl that she always wanted.
Okay.